Hey, Dr. James Fenix, Village Family Clinic. A quick little lesson for you. We're talking about safety pin cycles. This is a really popular message out in chiropractic land. Tell you a little bit about more how your brain and body works here. So we all know up top we have our brain, right? It's the master controller. A lot of times when we do talks, people ask, what's the most important organ? We'll get heart a lot. But always say, if your brain didn't tell your heart to beat, it wouldn't beat, right? So if you don't have a brain, you don't have anything. So the brain's up top, the master controller. And it talks to the rest of the body through your nerves, right? So we have these nerves coming out and they talk to your body down here. All right. So the brain's up top, sends electrical signals through the nervous system to all the cells, tissue, and organs in the body. So down here's the body, but when we feel or touch something, it needs to talk back. So everybody's made the mistake of touching a hot stove once, right? So we move our hand pretty quick if you touch that stove. So what happens is the body gets that message that it's hot, sends these signals back up through the nervous system and up to the brain. The brain then, just in that split second, sends a signal back down through different nerve channels to tell you to move your hand off the hot stove. That's kind of how the body works all the time. But we found if there's any disconnection between these, we can have a problem. So researchers have found that just a weight of a nickel, one nickel on one of these nerves will impede the flow. So that's how little pressure we need to have on one of these nerves in the spine to impede the flow of that nerve. If there's any disconnection here between the brain and the body by pressure on the nerves, chiropractors call that a subluxation. It means less than, right? So it's decreasing the power of the nerves, not able to communicate. So this nerve goes down to your foot, might be giving you sciatica. That nerve's going to the lungs, might be asthma. I just treated children with ear infections. If that nerve's going to the ear, anything that ear goes, just enough pressure of a nickel can impede that nerve flow. So what we do with chiropractic adjustments is we use our hands to get that pressure off of that nerve, allowing the brain to talk to the body. It also works the opposite way as well. So people with numbness in their extremities, paresthesias, those kind of things, the signal from the body's not getting back up to the brain. So if there's a little disconnection there as well, people say they can't feel their fingers and toes like Raynaud's, or we're having neuropathies, those types of things. The brain doesn't know what's going on with the body. So I think we want to know always where our hands and feet are in space. But if there's any disconnection there as well, we're not able to communicate. So it's important to keep these nerve channels open so the brain can talk to the body and the body can talk to the brain. Call it a safety pin cycle because when you draw it out, kind of looks a little bit of safety pin. So that's why as chiropractors, we want you to get your nervous system checked, keep those nerve channels open as much as possible to allow this constant communication flow. If there's any disruption in this flow, we can have all types of problems, not just pain, numbness, and tingling, but other things like asthma, allergies, sinus problems. So I've also had a lot of people say their allergies and sinuses are getting better when they're under chiropractic care. So it's always important to always keep that brain-body connection open and alive and well.